Hello, my name is Valentina Mauro. I'm a consultant gynecology specialist in infertility. Today I would like to talk to you about general infertility and particularly fertility awareness. Infertility is more common than people realize. Globally, about 1 in 6 people in reproductive age experience infertility at some point. In the UK, this translates to about 10 to 15% of the couple. The causes of infertility are quite balanced. 20 to 35% are male-related, another 20 to 35% are female-related, but sometimes there is a combination of factors that can contribute to infertility, and about 25 to 40% will involve both partners. 10 to 20% remain unexplained. We do recommend to see a specialist after 12 months of unprotected intercourse without success, or 6 months if you're over 35. However, if you have already predisposing factors such as polycystic ovary syndrome, endometriosis, known tubal blockage, or a history of miscarriages, we would recommend to see a specialist sooner. What happened? The fertility start to decline in the mid-30s, and by the age of 40, the natural conception rate dropped more significantly, with an increased risk of miscarriage. We do recommend, therefore, women of this age to see a fertility specialist sooner. What do we do? Well, the first step is assessing your fertility with an MOT. MOT would include some blood tests, most of the time only for the female partner, and such as the assessment of the anti-Mullerian hormone, for example, to evaluate a woman's ovarian reserve, but also to assess the thyroid hormone, which sometimes can contribute to ovulatory dysfunction. We do carry out a pelvic scan to assess the ovarian reserve, but also we will assess the semen assessment for the partner, as all these factors give us an idea of if there is any underlying factor that should be considered before stepping into treatment, and what treatment may be recommended, if any, at that point. After the MOT, we may recommend to proceed with one of the most advanced procedure, which might be IVF or may be ICSI. Some patients may require the additional genetic testing, for example, if there is any risk of miscarriage, for example, or there is any issues related to age. We would discuss, as a fertility specialist, we will discuss with you the options you've got available. Just a little mention about unexplained infertility, which sometimes can be a bit frustrating if no cause of infertility has been identified. It affects about 1 in 5 couples, and it is unexplained because we haven't found a particularly underlying factor on why a couple has not been able to conceive. In my experience, some patients have then ended up conceiving, say, after an IVF cycle, or perhaps they never end up conceiving and require the help of IVF and ICSI. In any case, there is help out there, and we are here for you to support you and to guide you through the processes, and explain to you in detail what will be the best option to achieve success during your journey.